going to present to you is a little bit of overview of some things and approaches you should consider as you are reopening your parks and recreation facilities and addressing the
Unknown
myriad of
participant is now joining.
challenges that COVID-19 has placed upon you in your role. As parks and recreational professionals, you know that, especially during the summer months, you're an integral part of most communities' educational, recreational opportunities, and in many cases, play an integral role in, providing services for children and people really depend upon those services, and everything has been turned on its head. Um, and not only are you now reopening and differently and later, but with a lot of health challenges that have to be addressed also. So tried to pull together a variety of
Tim.
um,
Is now joining.
resources from national, state, and professional associations that can be useful for you. We'll try to keep this to around 45 minutes to 50 minutes in presentation. Happy to take questions at any point if that's appropriate for you, but to leave plenty of time for you to ask specific questions, because it's hard to address the unique needs of every organization and community, because it really is going to vary depending upon the services that you're. So a little bit quickly about myself. I am, as Kimberly mentioned, the vice president with the Matrix Consulting Group. We are a local government management consulting firm, and one of the areas that we work in is parks and recreation, typically operational and staffing studies. So we're very pleased to be providing some resources to our clients and to Perma's clients here today. The broad agenda that we're going to go through has sort of 11 components. I won't read all these to you, but just in general, it talks about developing a reopening team and plan. We'll go over some of the key guidance that's out there available for you. Talk a little bit about assessing the risks for specific facility spaces and programs. Talk about phasing considerations. Spend some time on the communication plan, specific guidance for certain parks and recreation facilities and programs. We want to make sure we talk about other components of this also, including staff training requirements, how you're going to train and protect them and the public. And that can include a section on training and disinfection practices, how you might manage contracts and vendors, ongoing contingency planning, and then some additional resources. We'll try to cover as much as possible in the presentation, but we'll be open to discussing anything that you might have at the end. So as you know, there's a lot of guidance out there that you can take advantage of, and you're probably being overwhelmed with the number of resources out there. So I wanted to highlight a few that I have found very useful, very specific and on target for some of our clients, and hopefully they'd be useful for you. So I think the first place to start is with the national CDC recommendations. And I've given you 3 links in here. Obviously, you don't have to write them down because you'll get a copy of this. But if you haven't looked at this, obviously the CDC in the first one provides some very generic guidance on dealing with COVID. But it has a couple very specific areas that I think are appropriate for you to review. One has to do with youth and summer camps and the challenges associated with those. The second deals with public pools, hot tubs, and water playgrounds. So if your community has that as a resource, I think that provides some really targeted information. And then they have a broader one that covers parks and recreation in general for parks and recreation administrators. So we provided 3 links there. Obviously, because you are all in New York, you want to stay up with the specific and
now exiting
guidelines from the state of New York. So we've given you the broad link to their resources there. And then finally, there's a couple professional associations that are particularly relevant. The National Recreation and Parks Association, which I assume many of you are members of. If you're not, if you are, you're probably already aware of these resources, and we've
is
pulled
now joining
from that. But if you're not a member, you definitely want to look at that. And a lot of the COVID-related resources are available without being a member, so it makes it very beneficial. There's a specific association called the National Institute of Senior Centers that has some specific information that's appropriate to our senior populations. And then the International City County Management Association, which is an association for city and county managers, as it says, but they have a dedicated section within their resources for parks and recreation facilities and programs. So I found that those are three very good resources. They're very in-depth. The NRPA alone has about a 23-page summary, and I'll reference this again later, where they provide very specific guidance and consideration for every conceivable type of parks and recreation facility or program. And it really allows you to see what some others have done and things that you should consider. I think the important thing to keep in mind here is that you do not need to recreate the wheel as you're putting together these plans and figuring out how to reopen your programs and your facilities. But you do want to make sure as you're using these other resources that you tailor them specifically to your organization, because you will have to make some assessments about the risk you're willing to absorb, the personnel rules that you have to work within, and your community specific needs and desires. And each of those are going to have some impact on the services or approach that you take in providing or reopening the programs and services that you have. I want to start by giving you a quick overview of the parks and recreation industry nationally. While many states are slightly ahead of New York in their reopening phase, you're not alone in the situation you're in. But in a recent survey, the most recent one that the National Parks and Recreation Association did from June 10th to 12th, they did a survey to find out what types of facilities were open. And I won't read all these, but you can see that of those facilities open, trails is virtually at 100% at 98, local parks at 97, golf courses 96, and moving down to permanent restrooms at about 52%. I think the takeaway for this is those type of facilities that are typically outdoor with less congregation, they're more individual or small group activities where you can have greater physical distancing among participants or control access better. Those have opened up earlier than other types. And I think that's something to keep in mind as you're putting together your plans for how do we phase in reopening, to take some consideration for how others have done this. And gives you a good view of the facilities that have been easiest to open to start getting people back into those recreational activities. At the time of this survey, which was again about a week and a half ago, the following items were still closed. So about 93% of senior centers still closed, obviously because of them being a higher risk group, typically, not always, but typically having other issues associated with it. Indoor gyms and recreation centers, playgrounds, still closed at a preponderance of a majority of the survey participants. Drinking fountains were closed. So you can see that those indoor activities and those that are typically higher use or more concentrated use are the ones that have been opening at a slower rate. The other interesting point in this survey was dealing with summer sports. And while most of the parks and recreation agencies that responded are offering or are going to be offering most of their summer sports programs, you'll notice that a high percentage of them are going to be doing it with modifications. And that varies from the number of games or interactions they're having, limiting contact and other things that they're doing. Some traveling groups are reducing the level of travel or the number of teams that they're interacting with. So while these summer sports, which are usually a large percentage of summer programming efforts in the athletic area, are reopening, it's not business as usual. There's a lot of modifications being made there. Another thing that Parks and Recreation agencies have been dealing with is when we are reopening, how do we handle face coverings? And this is, I think, an important thing for you to keep in mind and talk with your staff about and have some policies for your organization. It's not just whether or not you require it. When it's required by the state or local ordinance, you don't have to worry about making that determination, but you do have to consider how you're going to enforce it. And what we found with parks agencies and recreation agencies across the nation is this is something many of their staff have not been trained or contemplated having to be put in the position of enforcing, face covering rules. The percentages that are outlined here show that, for athletic fields, at this point in time, 60% were advising use of face coverings, 5% were requiring it. In parks, similar, 58% were advising and 8% requiring. And it drops down. Obviously, pools are a unique one, the one at the bottom, where 39% are advising and only 27% requiring it. Obviously, that's not while they're swimming, because they're not recommended to be worn while swimming. But generally, the trend is to require and encourage those face coverings whenever possible to limit, transmission. But just having that rule and having that posted isn't the end of your role. You have to figure out, are your frontline staff going to enforce that? And if they are, what support can you provide to them when people are non-compliant? One of the unfortunate things we're seeing is, even in the face of strong direction from governing authorities about the appropriateness or requirement to wear masks, there are a lot of people who have different personal opinions about the wearing of masks, and your staff does need to be trained and prepared to address that. And I guess the best advice I can share with you is it needs to just be a factual, this is the policy that's in place and here's how we're enforcing it. And it becomes then a personal choice for the participant whether to comply or not take advantage of your facilities. You don't need or want your staff getting involved into arguing over the benefit of masks or whether it's the appropriate policy. So you need to really make sure you have the procedures in place to support the people who have to be out there interacting with the public, because it's one where we're starting to see a lot of pushback and a high level of non-compliance in some areas. So moving on, I want to talk a little bit about now that you're preparing plans or starting to think about preparing plans, how are you going to phase in and reopen some of these facilities? The best advice we can give you is to do a quick risk assessment for each of your facilities, parks, spaces, and programs, taking into account and keeping in mind some of the following factors. Do you have the ability to adjust occupancy or the concentration of use? That's easier to do in some outdoor areas where you can encourage the physical distancing. Interior spaces, it gets more difficult, and many of the services provided, such as specifically programming or recreation programs, you typically have, while you have class size limitations, those class size limitations have not historically been established based upon public health needs, but other needs, such as what your facility can reasonably accommodate, what number of participants you need to make the program financially feasible. What you need to start taking into account now is, how many people can we have in this interior space or this program and still be in compliance with physical distancing? Can the program still be provided with the use or wearing of face masks and other health measures? And does that mean certain programs can no longer be offered? So you need to do that risk assessment. Also looking at control of users and participants. What modifications do you need to make to your facility, your parking lot, your outdoor spaces to control the number of users? And do you have the the physical and staffing resources to implement and control those. Cleaning is a real basic thing. I think there's more guidance out there than I can provide on the appropriate types of cleaning protocols. So make use of those. But the key consideration I want you to think about is, do we have the staff to clean at the level of frequency that's being recommended? Historically, most parks and recreation agencies have built up a staffing model to provide a good level of cleaning, but probably not the level of cleaning that's now required for high-touch surfaces and frequently used facilities, including restrooms, washrooms, and just general meeting rooms. If you don't have access to the cleaning supplies or access to sufficient staff to hit those health guidelines, you need to make some considerations. Are we going to delay opening some of these facilities, reduce the number of programs so that we can maintain that? All of these things obviously have some fiscal impacts to your organization. And canceling of programs, not opening facilities reduces the revenue comes in, which has additional impacts in terms of the revenue stream and resources you have to provide these additional requirements. And then finally, when you're looking at these facilities and programs and spaces, is what's the feasibility that you can operate successfully at lower occupancies, as we talked about earlier? Are there other ways that you can continue to provide services rather than in person? One of the few benefits perhaps of the whole COVID-19 thing is we have seen some innovations from parks and recreation facilities around the nation, greater use of online services for program provision, the use of video programs for, Zumba by Zoom, a lot of ways to outreach and continue to provide these services when we can't be physically together. Consider whether you can continue to provide that so that while some people may be providing or accessing the service in person, you can still have some online provision of those services for people who may not be comfortable yet with in-person service access, or because of limitations, you can't allow as many people to access that. I want to just very briefly along this risk assessment component point you to some specific guidance that the National Parks and Recreation Association has put out based upon a document provided by Johns Hopkins, the Bloomberg School of Public Health. They developed a risk assessment based specifically on three things: contact intensity, the number of contacts, and the degree to which your activity can be modified through mitigation. And I'm just going to show you a piece of this, but it provides a quick way for you to, in the first column, categorize each of your programs or services or facilities, and then assign a rating, whether it's a low contact intensity, the number of contacts for that facility, program, or space, and what's the potential to modify that. So for example, parks and walking paths, trails, dog parks, typically are low contact intensity. People are participating in these in individual or very small groups rather than high contact. The number of contacts between people, again, is very low, but the potential to modify those services are also low. But when you go through this, it will provide you a way to say those that have low contact intensity and low number of contacts are probably easier to open up quickly because they require fewer changes in how you provide existing services. Those that have high contact intensity and medium or higher number of contacts are ones where you're going to have to spend more time discussing the potential modifications and other aspects of that service delivery. So if you look further down this screen, if you can see the size of it, because it is rather small, I'm sure, theaters, museums, and other indoor leisure spaces, sort of a medium contact intensity, but a high number of contacts. So that's one where you would need to spend a little bit more time talking about how do we manage our occupancy? How do we ensure interior cleaning protocols are meeting the needs of the participants? What sort of other public health measures are we going to require in these. And then those of high contact intensity, such as the overnight programs, childcare facilities, contact sports, are the ones that may be phased in later or may have greater restrictions and health protocols placed on them. So if you read through the more detailed background on this, I think this provides a really good way for you to quickly get an assessment of your entire program offering and facility offering to determine which ones can we open quickly, what level of modification is it going to take, and which do we need to maybe put off and think about in a future phase. I think it's really important, although I know the timing to do this is difficult, is to put together a very specific and phased reopening plan. So after you've done that risk assessment, put together a plan, even if it's what we might call a minimal plan or very outline approach that talks about the timing and reopening of each of your facilities and programs. If you haven't already shared that information with your residents and customers, it's something they're going to want to know. And the more you can manage their expectations about when things will be opening and how they'll access them, the easier it will be for them to comply, as well as for you to spend more time providing the service rather than answering questions. Be clear about operating hours. Those are things that are being modified quite a bit from typical hours as we've had to adjust staffing and other requirements. Talk about the types of activities you'll have during each of those reopening. Any adjustments to the service, if you're going to limit some contact or limit the number, give some indication of the staffing plans. Many organizations, especially Parks and Recreation with frontline services, have had to actually increase staffing in some areas to have greater number of frontline personnel for crowd control, for enforcement of their operating procedures, and for cleaning. So make those measures aware to the public so that they understand why those people are there. And then at least briefly talk about the cleaning protocols that you're going to be implementing. And this is one, to ensure people that you're doing it appropriately, but also to let them know, here's what we think is appropriate. And if they have a different expectation of what is appropriate for that activity, they can make a conscious decision about whether to participate or not. One of the other challenges we're seeing for Parks and Recreation administrators is that you're not dealing with just one client base. You're dealing with individuals from preschool through seniors, high risk and low risk. And each of those groups have different needs. And you're not always going to know what those needs are. So the more information you can provide allows people to make some personal decisions about whether they're comfortable participating in your programs. Once you put together the plan, and this goes without saying, and most Parks and Recreation entities are really good at the communication, because you have to do that with all of your programs, but make sure you get the information out there about how you're reopening, the timing, the approaches you're taking, the services that will be provided or not provided, and really hit that reopening schedule and any limitations, the capacity constraints, the cleaning and safety protocols again, and then any user requirements, masks, hand washing requirements, or time limitations, how long people can be at a facility. Use as many methods of communication as possible, whether that's signs at the facilities, your website, social media, press releases, newsletters. Use every available method you have to get that word out. Because again, just like you have a variety of different customers with different health needs and service needs, they all access this information differently, and there isn't a one-size-fits-all to get that word out. Fortunately, I think most Parks and Recreation agencies are really good at the public outreach in terms of getting information out about their programs. The difficulty here is the volume of communication you may have to be doing and the frequency at which you have to change it. Because as you know, the requirements that are coming down from the CDC, the federal, the state levels are changing based upon what we're seeing in the communities, whether we're being successful in reducing our control of COVID, When there are spikes or hotspots, you're going to need to be able to adjust quickly in your plan. I want to highlight for a couple minutes a focus on your staff. Your staff historically have been hired and trained to provide parks and recreation services, whether that's direct programming or cleaning parks or maintaining parks and facilities. They haven't always been trained to deal with the public in the way they're going to be asked to deal with now. And so you need to really consider what are the approaches we're going to take to protect them, to prepare them, and make them comfortable in the new role that we may be asking of them. So think about, do we need to have some specialized training for staff before we put them in this new environment? Covering changes in their duties. You may be making modifications to how they typically provide services, or cleaning requirements that they may have to participate in if they haven't in the past, and crowd control or public interaction that they need to do differently than the past. You need to train them to be prepared to handle that. Consider how you're going to handle the PPE for your employees. Cloth, face coverings, and masks. When are you going to require them to wear them? All the time on the job, only in interactions with the public, or something in between, depending upon their performance. The availability of hand sanitizers, antiseptic wipes, and other things. If you're going to use a screening-based approach to any services or checking of employees, you need to make sure you have the appropriate equipment there. And gloves for people who are handling cash, accepting applications, and otherwise interacting with the public in a direct person-to-person interaction. A lot of organizations are trying to get away from those interactions by limiting cash handling, whether that's payment only in credit cards or only online or invoicing for services. All of those things are appropriate to consider and appropriate to implement, but
unknown participant is now exiting.
But does require you to implement new procedures or policies that you may not have had in place in the past. And the more you're changing your operating procedures, the more work that puts on you in preparation for this. So look at the question of whether you have the sufficient supplies to protect your employees. If you don't, or you can't protect all employees, you need to make some decisions about the services you're going to provide. You may have to also consult with your unions or employee groups, depending upon the types of changes you may be implementing. If you're trying to implement changes in employee job duties, there may be some obligations for meet and confer or actual negotiations before making some of those changes. So make some considerations about the type of employee interaction you have to have before you make some of those changes. I'm going to quickly talk about this slide because I think a lot of this you've probably covered or have been hearing a lot about, but make sure you have and train your staff on those appropriate cleaning procedures, both for the workspaces and general areas, the frequent and proper hand washing, social distancing, provide self-check stations with thermometers, and providing the 6-foot minimum distance throughout your work sites. So this is all about the employee basis. So we're talking about employee break rooms, work rooms, when they're working together. We need to still maintain some social and physical distancing there. Continue to utilize remote meetings where possible, limiting those in-person meetings, closing common areas if possible, staggering work shifts, having people work at different hours of the day if possible. Addressing restroom use, which is a pretty important factor, not just for employees, but for the public, and we'll talk about the public in a minute. Limiting people using elevators and other enclosed spaces at one time, and limiting vehicle use. A lot of organizations have now limited vehicles to 1 employee whenever possible, so that, again, you're limiting the potential exposure of your employees. There's a really good resource, again, from the NRPA based upon OSHA guidance, and this is at the website I provided earlier, but it groups common parks and recreation employee positions into three categories: high exposure, medium exposure, and low exposure. High exposure typically involves those who are staff deployed at testing or treatment sites, shelter sites, or healthcare sites. For the majority of your programs, you probably don't have people in those high risk exposures, but if you do, it provides an outline of the type of PPE needs for those individuals. Respirators, the N95, when you're dealing with confirmed or suspected cases, eye protection, disposable gloves, and gowns. I think most of you will find that your employees fall into that medium or low risk. Medium risk are those jobs that have frequent or close contact with people who may be infected, but are not known or suspected patients. So this includes your janitorial sanitation staff, childcare, summer camp, shelter, recreation centers, senior centers, your events, aquatics, exercise instruction. Vast majority of your programming falls into this category. It would also include park rangers or law enforcement individuals, park ambassadors, service area staff, and volunteers who are out there assisting in or providing services to your public. The typical PPE needs are much lower here. It still includes the face coverings or the face mask, depending upon the job, eye protection, depending upon the job duties, and gloves and gowns, again, depending upon the duties and whether it's a known or suspected case. So you need to tailor these specifically to each of those categories, but clearly this is a much lower concern than those at high risk. And then you will likely have a small group of employees who fall in the low exposure risk. These would be your outdoor maintenance staff, property maintenance, and administrative staff. So there's fewer interactions with the public. Where you're doing it, it's typically easier to maintain that physical distancing, or you're outdoors and you're not really readily interacting with them. So then you're typically limited to the face covering and limited use of gowns and gloves and eye protection. Other ways that you need to consider modification to your facilities to protect the public is using, the sneeze guards or those plexiglass barriers that are popping up in most areas, at public counters and other areas where you have those public interaction, encouraging or requiring the use of masks inside your facilities, putting off the markings on the floors to promote the social or physical distancing for people in queues or waiting for services, limiting chairs in seating areas so that you're, again, removing a opportunity for people to congregate closely, and again, encouraging remote interaction with your staff whenever possible. Take advantage of some of the new normals that have developed. People are getting much more comfortable interacting via phone and video conferencing for a lot of services that they weren't before. Continue to use those where possible. In terms of protecting the public, some of the considerations you want to take into account as you're looking at how you're going to do that is, as you're going through that assessment we talked about earlier, both by facility and programs, look at occupancy or numerical limits on those services. How many people can you reasonably have in that facility or recreation area or program and still maintain those social distancing requirements? It's not going to be the same consideration you made in the past, as I noted, regarding occupancy limits for the facility or the program, but now we're taking into account the health impact. So do we have to set new limits on that? And how are you going to control that? Can you use the take a number approach in some areas, where people are only coming into your facility when they receive a text or a phone message saying it's their turn for service, or a numerical display that tells people when it's their turn to be provided service? That only really works in those customer-facing things where you can do an appointment type-based interaction. For programming things, you're going to have to look at other approaches. In terms of a good example is with dog parks. Many organizations have put a reduced limit on the number of people using it. It's typically been a self-imposed or self-monitored limit, and they're not actually putting staff there. They don't typically staff those. They're not using staff to enforce it, but they're requesting the public to help them manage that expectation. Again, are you going to implement or use temperature controls before people come into your facilities? And you may only do that for very high use or high occupancy facilities where you are going to have people in closer proximity. When you're doing your assessment and as you're looking at all your programs and servicing, you really need to consider the restroom use. Parks and recreation agencies have typically been a high provider of these, especially in your outdoor facilities. If you're not able to maintain access to and the openness of those outdoor restrooms, you're going to need to make some conscious efforts to inform people about that, because it does impact how they prepare and use the facilities. Some organizations have started using some more of the temporary restroom facilities because they're easier to rotate use and lock down and clean. Others are able to increase the frequency of their permanent facilities at a level that they're comfortable opening them. But it's something you need to really consciously determine and staff to maintain them, because public does need to know how you're going to do that in order to appropriately use it. And finally, when you're doing the risk assessment and looking at these programs, think about your vulnerable populations, not just the typical user. So again, we talked earlier a little bit about seniors who may have, due to increased age and potential health conditions, an increased risk. Younger children who, while the science may have less of a risk, have some other concerns that we need to be aware of. They're much less able to comply with the physical distancing, the cleaning and preventative measures that are being recommended in terms of consistent use of masks and appropriate hand cleaning and maintaining that distancing. So you may need to have smaller participant levels for children than historically, because you need to have a higher staff to student ratio in order to maintain appropriate health concerns. Underlying health conditions, which you may or may not know, but you may want to point out to people that those with those conditions may need to talk with you about services before they access them, or at least put some information out there about the potential increased risk, because you're not going to know who these individuals are, but if you can provide information about what you're doing, they can make their own decisions. And then the last vulnerable population I really wanted to highlight is those who have mobility issues. As our parks and recreation programs and facilities have become more accessible to those with those mobility restrictions, you need to think about how can you continue to provide those services. If you have been providing higher levels of staffing to assist people in accessing your services, you need to think about, can you continue to maintain that if it requires them to physically assist in the movement or entrance of these individuals to the program or service, or are they on their own and you're just going to provide whatever access they can achieve on their own. Something just to consider, because you may not be able to provide that heightened level of access that you have in the past. I want to really spend a few minutes talking about this area, and this may be one we talk more about in the Q&A. But one of the best resources out there I've seen that gets into a lot of detail about specific guidance on specific facilities and types of services is, again, from the NRPA. It's a long URL, but hopefully when you get this, you can type it in or you can Google and find it. But for each of these elements, athletic fields, beaches, childcare, all the groups that you can see there, they give you the types of things you should consider as you're developing your plan, reopening these facilities, potential ways to modify these programs to address COVID and other issues, and some other background information, in some cases, specific guidance on cleaning protocols and disinfection approaches for each of these areas. And it really is an invaluable resource, I think, for you to address some of those unique needs. you've probably seen, and you may be concerned about how are people going to react when you start opening some of these services. I'm sure you've all seen the Lake of the Ozarks issue in Missouri that hit the national news when they opened up. It was overcapacity. It looked like nothing had ever occurred in the last 3 months. That was, I believe, a private facility. It really lost control of those entering. It couldn't enforce anything. Fortunately, I think as time has passed, we found that there were a few outbreaks or spreading a disease related to that, but it was a high risk environment. You need to be prepared as you're opening these, even if your guidance is clear on the occupancy or the user limits and the approaches people have to take while they're using them, how you're going to enforce that, and be prepared to shut down or modify that approach based upon how your residents and consumers act. That's the unpredictable nature. You can have the best laid plan, but if people aren't using it as you intended and as you're directing, you need to be prepared to step in. And that may mean temporary halting the service, closing a facility, readjusting the numbers you're letting in, how you're staffing it. It is going to be a constant state of pivot from point A to B to C, depending upon what you're faced with. And if I were you, I would go in and print this resource out. It's about when you print it out, it's about 23 pages, but it goes through for each of those elements, key considerations, gives you some great specific directions on things you can do, what is viewed as appropriate, cleaning protocols, usage protocols, and potential modifications.
Don Fisher.
Is now exiting.
And we'll come back to that on specific questions if you want to talk about that. A couple more items, and then we'll open it up for questions, either things we didn't cover or things you want to talk more about. Don't forget to overlook your vendors and contractors when you're putting your plan together or developing your protocols for reopening, especially if you're using them to provide services on your behalf. So if you're contracting for programs or you contract out operation of some of your facilities, you not only need to know how you're going to direct them to operate on your behalf, but how they're going to enforce it on their own staff or individually, and how are you going to, ensure their compliance? What access to facilities do they have? Can they comply with your restrictions? Are they following the same protocols? If they are doing this on your behalf for money, so they're either operating the facility or they're running a program, you may need to consider, do we have to change our contract with them if we are increasing the cleaning protocols on them, or we're reducing the participant levels for the programs they're providing? Were the previously negotiated fees appropriate, or do we make some adjustments there? Are we changing the hours under which they intended to operate? All key considerations that you'll have to address in working with that contractor or vendor in terms of how they're going to continue to provide service to you, because most of those contracts were developed with a different approach in mind. I think if I haven't said this a couple times, I'll say it again. You're going to put your plan together, you're going to place it out there, you're going to start opening. You need to have constant updating and communications regarding changes to that. If your internal team isn't looking at this or having a brief debriefing session daily, if not at least weekly, if not more frequently than that, it's not going to work for you. It really is something that requires constant updating, discussion, and modification, and then communicating those changes as widely as you did your original reopening plan. If you're able to accommodate that and put those in place, we're finding that the Parks and Recreation agencies are having great success in reopening their programs. There's a huge unmet need. There's a desire for the public to access it. And they're
now exiting.
Clamoring for this. There are a few additional resources I just want to point out. The slides at the front I think are the most critical one, but there is a whole nother list of resources from NPRA. We've provided a link to them. Look at some of the other communities that have reopened in other states. there are some amazing examples of reopening plans on their websites. Don't reinvent the wheel, use it. Just make sure you tailor it to your facilities, your staffing, and your risk level. You can't, it's not a one size fits all. You really do have to own this and make it yours, but the general approaches to take are there for your use in putting together your plan. You have to determine the risk you're willing to assume it as an organization based upon the guidance you've been given, but probably more critically, what your staffing and fiscal constraints are. Those are going to impact most of the reopening plans and service provisions more than anything. You're more than likely scaling back what you've done. Even with that, there are a lot of increased costs that we haven't anticipated when budgets were developed. So you'll have to figure out ways to adjust to that and make sure that fits your needs. So with that, I'll stop talking. I think it's been about 50 minutes and open it up to questions. You are welcome to ask me about anything in the presentation, anything not covered, anything that you're thinking about or need to resolve. If I can't answer it, we'll try to find you another resource, or maybe there will be an expert on the line with us from one of your peer entities.
Perfect, Alan. So we do have 2 questions in the chat feature, but if you do have more questions, send them in the chat or raise your hand. So the first one we have, with private entities Zoom, I am not seeing waivers hold harmless. Do you recommend for public entities?
Great question. So before I answer let me just say I am not an attorney and I don't play one on TV, but I would consult your attorney. I do think it is at a minimum appropriate to post some disclosure of your approach. Some communities are taking the use at your own risk. They're just posting that. Others, for especially some high intensity or high interaction and high contact programs in sports, they are going with a more formal waiver. Exactly what you can impose in New York is going to be dependent upon your specific legal advice, but where we're seeing others using it are on some of the high intensity sports and league activities, especially traveling leagues where they're interacting with individuals in a much broader scale across the nation, or obviously by involving travel, you have greater interaction with hotels and other things versus interactions that are at a youth level where it's you're playing teams within your same community. There's a different level of risk there. Other ones would be if and when you get to the larger group activities, there are some entities that are using those waivers. I'm sure we've all heard about them on the national news also for attending those larger events. Those, whether you can enforce them and what legal enforcement they have, I'll leave to you and your attorneys, but we are seeing people use them in some areas, and definitely they're posting use at your own risk signs throughout their facilities, and making people aware it is a personal decision that they have to take. How legally that is, how that would work out in a court of law if something occurs, I don't know, and I can't maybe even estimate or guess what that might be.
Okay, great. So the next one we have seen municipalities who are opening playgrounds without cleaning, sanitizing. What is your guidance on this?
I think no cleaning and sanitation is personally is not appropriate. I think there needs to be some level of cleaning and sanitation. What we're hearing from many other parks and recreation entities is the guidance they're seeing and using isn't greatly above what they've had in the past, but there is greater cleaning for high contact areas. But that's one area where we're seeing a lot of the postings of here is our cleaning protocol. And if that's nothing, you would say that. If it's, we clean at these frequencies, you're sharing that information with them, acknowledging that there may still be risks, and it's up to individuals to make that decision about whether or not to utilize the facility. Because those type of activities, the playground equipment, you cannot sanitize between each use, unlike something in
Is now exiting.
unlike if you provide a health club environment where you can sanitize equipment between each use. So there's no way for you to make it completely safe and to manage that entire risk for the user. You couldn't staff at that level and clean it frequently enough. But we are seeing greater levels of cleaning and sanitation than historically have been in place.
So we did have, can you share the NRPA guidance in an email to this group? I had a hard time finding it. So we can definitely get that for you, Charles, and get that sent over to you. Then Andrew said, thank you for the presentation, very informative. I think that's all the questions we do have, but if you do think of one, you can send them to our member services email at PERMA, so memberservices@perma.org. I can forward it to Alan.
Yes.
And we can definitely get your questions answered. Also, PERMA will be providing reopening instructions for the various municipal departments, and that's going to be on the PERMA COVID-19 page on our website. So there's going to be lots of resources for everyone to have. As well as this has been recorded, so we're going to be able to send the link to everyone in case anyone missed it and upload it as well. But I want to thank you so much, Alan. This was great.
Our pleasure, my pleasure. And really welcome to answer any questions. Send them our way. We'll provide whatever resources we can. And I'll send you some additional links for
is now exiting.
some of the elements that we referenced in here.
Perfect. We will definitely get those sent out as well. And thank you so much, everyone, for attending. This was great.
Elizabeth Martin, Village of Chittenango.
Is now exiting.
But thank you all for coming and have a great day, everyone.
Multiple people are now exiting.